let's look at the start of this year. The government's got a range of issues, very expensive challenges, not the least of which is Medicare, which the government concedes needs a lot of reform.
Yeah, there was a leak this morning, Kieran, to the Australian newspaper about how Medicare could be expanded to take on the likes of paramedics and nurses. Well, the PM made clear this morning that work needs to be done before there is a concrete plan on this, but they are heading in this direction.
We'll receive this report and go through it in the lead up to the May budget. But what we know we need to do is to fix primary health care, because if you don't get primary health care, it ends up costing more. We'll receive the report. The report this morning preempts that a little bit. We want to see all of the detail.
So this is something, as I understand it, that the New South Wales and Victorian premiers have been advocating for in health reforms they are pushing for at a National Cabinet meeting next month. Now, this will obviously, you would think, require a lot more money in the federal budget. Just to give you an example of how it would work, particularly in, say, regional areas. Instead of people being taken to hospital, Medicare could fund paramedics treating them in the home, say for wounds or to give people scripts for antibiotics or those sorts of measures, and Medicare would fund that. This has been pushed by the Health Services Union and no doubt supported by the Nurses Association, both of whom are important constituents for Labor. But the big issue the idea raises is how much more money will this require and what goes in the federal budget in May in order to fund it, Kieran?